This is Talk with Audrey. Welcome back. Protecting our skin from the sun should be top of mind, especially this time of the year. But there's a new survey by the Skin Cancer Foundation that revealed that most Americans aren't aware of a potentially threatening skin cancer known as CSCC. My guests today are Dr. Ariel Ostad and Ron Maniloff. We're going to talk about the survey and why skin cancer awareness is so important. Welcome.
Good morning.
Hello.
Hello.
Dr. Ostad, what is CSCC?
CSCC stands for cutaneous squamous cell carcinoma. It is the second most common skin cancer of all. 1 million cases are diagnosed in the U.S. alone each year, and this type of cancer occurs more than a combination of breast, lung, and prostate cancer combined.
Wow, so it's pretty common.
It is extremely common, and that is unfortunately what this survey discovered, is that majority of people don't know about it. This survey was initially conducted by the Harris Poll on behalf of the Skin Cancer Foundation in coordination with Regeneron and Sanofi. And there's some surprising facts that came as a result of the information from this survey. Mainly a couple of things. Number one, that about 3 out of 4 Americans are not familiar with squamous cell carcinoma of the skin. More than half of Americans incorrectly think that melanoma is the most common type of cancer, yet cutaneous squamous cell carcinoma is actually diagnosed 5 times more often. And furthermore, what this survey discovered is that only about 1 out of 4 Americans know that cutaneous squamous cell carcinoma can be life-threatening when advanced.
And who's at risk?
So the most common person who's at risk is someone who's fair-skinned, blonde hair, blue-eyed, generally people over 65 years old who live in the southern part of the U.S. But certainly in my practice, I've seen any type of skin and any type of individual with any type of skin develop this. So no one's really immune. And that's why it's so important to pass this information to the audience.
What are some of the signs? And is this something that someone would notice?
Absolutely. And the important thing is that, squamous cell carcinoma of the skin generally presents as a bump, as a growth that basically starts out obviously very small. It may appear warty, it may appear scaly, it may appear red, and eventually as it progresses, it can become painful, it can become itchy, and certainly grows in size. So the important information is that it is important that this type of cancer is detected early, and therefore you really have to believe your instincts, and that if you see something that presents itself and it's not going away after a couple of months, it's really important to seek treatment by a dermatologist early on to catch these things early.
And Ron, were you aware of CSCC prior to being diagnosed?
In a general sense, I was. I presented all the risk factors that the doctor had indicated: over 65, fair skin, blue eyes, and there was a time I had blonde hair, now no hair. That's just balding as you get older. I had advanced CSCC on my scalp. It was presenting itself this past October. Out of nowhere, 3 very large tumors appeared on my scalp. I was recovering from a prior dermatological procedure on my scalp, and while in recovery, these tumors developed with such rapidity. Frankly, it scared me to death. I wasn't aware that CSCC could be life-threatening, but told that it was, and I sought out treatment, being referred to an oncologist from my dermatologist for proactive care.
Did you spend a lot of time out in the sun?
In my generation, we weren't as well informed as we are now, so sure. And like a lot of people, foolish as it was at the time, to think iodine and baby oil were a great tanning procedure to use, and you'd bake in the sun. And I got sunburned plenty as a kid, and I guess because of my hereditary factors, I was certainly predisposed to cancer and have suffered from skin cancer all over my body for the last 30 years. But this particular episode, which is why we're here today, to talk about the seriousness of CSCC and how quickly it can advance from something that people might consider benign or not too serious, well, That's not always the case. So I suggest people become very proactive in their own care, examine themselves, don't procrastinate, and get to see a dermatologist as soon as possible in order to get on a proper course of treatment, whatever it might be and recommended by your particular physician.
Doctor, what's the treatment for CSCC?
Skin cancer of the skin can be treated early on with surgery with high success rate. However, if it does progress to an advanced stage, radiation, in some cases systemic therapy, may be considered.
And do you think that more people are now thinking about the risk of tanning and being out in the sun?
I certainly, in my practice over the last 22 years, I have seen a change in people's behavior. I think generally because of information that is available through news channels such as yours, people are certainly paying more attention and are more careful. There's certainly more use of sunscreens. Patients are more careful. And unfortunately, the problem happens is because majority of these cancers are due to sun exposure prior to the age of 18. And the young people are impressionable, and still the culture of tanning does exist, and people want to look their best. So as Ron mentioned, we still see people who unfortunately get sunburned. So we're fighting, and through organizations such as the Skin Cancer Foundation, we are trying to pass the message on that early detection leads to a cure, that prevention is critical, and hopefully make people more educated about the dangers of the sun.
And what about those patients who have cancer that's reoccurring and advancing?
So it's important that those individuals who do have unfortunately advanced cancer, that there's a multidisciplinary approach, and that those individuals, in combination with the help of their dermatologists, surgeons, as well as oncologists, are seeking proper treatment to treat them and hopefully help them. And it's really important that for people who want to get more information to visit the website skincancer.org/CSCC survey. There's an incredible amount of information that is useful for people.
Thank you both for joining me.